Hi, good day again, Minister. Today is Human Rights Day, and the UN High Commissioner for Human Rights says, and I quote, inequalities have fueled the pandemic and continue to do so, end of quote. She also says that there is unequal vaccine coverage, and by December 1, barely 8% of adults have received the one dose of the vaccine in low income families compared to 65% in high income countries. Can I ask you firstly, your thoughts on this statement, and is Guyana in that 8% bracket?
This has been a problem from the very beginning of the vaccination program. When vaccines first emerged in 2020, late 2020, uh, many countries did not have access to it. And because of this, that's why the COVAX mechanism was formed. In terms of whether we are in that 8%, as of yesterday, we have been able to give 435,085 doses of vaccines, uh, first dose vaccines, to persons living in Guyana. That takes our first dose coverage for our entire population at 56.3%. So we are, um, I would say, doing quite well in terms of our general population. And we have to remember that persons who are neonates to 11 years of age cannot access a vaccine because we don't have, first of all, vaccines being available for neonates to 5 years of age. And for the 5 to 11 years of age, we are working to get those vaccines. So you have a percentage of our population that we are not vaccinating as yet because, one, unavailability of the vaccine, and secondly, um, in that low age category, there's no vaccine that is available. Nevertheless, we are at 56.3% coverage for our population, first dose, and we are at 39.6% for second dose coverage. The WHO has set a target that by the end of December that we should have at least 40% coverage. So if we work hard enough, we would be able to complete that 40% coverage by the end of December.
All right, thank you, Minister. And because you mentioned about acquiring vaccines through the COVAX mechanism, can you reiterate the other steps taken by the government to acquire vaccines for citizens?
We have a combination: one, bilateral donations; two, um, purchasing vaccines, and those that I've just mentioned; and three, working through the COVAX mechanism to be able to get vaccines. And with these three mechanisms, we have been so far been able to have an adequate amount of vaccines made available to us. Well, we're working directly with COVAX, so we are expecting additional vaccines through the COVAX mechanism. We have from time to time been getting offers through some bilateral arrangements for vaccines. I expect those would continue in the near future, and we are going to continue to work with the government of the United States to get some more vaccines. So there are various mechanisms that we have currently available to us. Right now, we have enough vaccines in stock to give people who need to have their first dose, to give those persons first dose vaccines. Those who require a second dose, for them to get that second dose vaccine, and for those who require booster shots, for them to get those booster shots.
Could you remind us of the types of vaccines that are available right now?
So we have AstraZeneca, um, we have Sinopharm, we have Johnson and Johnson, we have Sputnik V, and we have Pfizer. So these are the vaccines that we are giving currently in Guyana. So, as of yesterday, we have completed for adults 405,436 first dose vaccines. This would be 79% of our adult population. And for second dose adult, it's 285,532 persons who would have completed their second dose. So this takes it up to about 55.7% of our adult population receiving a second dose vaccine. In terms of uh, persons between 12 and 17, we have administered 29,646 doses. That's about 40.7% of our of that age cohort, 12 to 17. And then for second dose, it's 20,896, or 28.7% of that age cohort. And booster doses, we have been able to complete now 4,951 booster doses.